So, yeah. We're now going to have a look at assisting a patient from sit to stand, and we're going to go from the chair to the bed. So, the patient is already on the edge of the seat with the feet tucked in nicely, and they're unable to get themselves independently up out of the chair. So I'm going to give a little bit of assistance. And this method can be done with assistance of two as well, one on either side. So I'm going to get into my fab stance, so my flexed knees, my alignment through my spine, and my slightly wide but deep base, keeping down nice and low to be in line with the patient, so that's called your fab stance. I'm going to put one hand in front of that shoulder just for stability, and the other hand goes down opposite to the opposite hip, and here we're going to use really clear communication. We're going to have a going forwards on ready, and then steady, and then standing up on the word stand. So if you always try to use ready, steady, stand, and the action comes on that third word, making sure everybody's clear with that communication when the action is required. So one hand on the front of the shoulder, the other on the opposite hip. And I'm going to say ready, steady, stand, and just bringing that foot forwards of mine. And then I'm going to give the patient a fist rather than an open hand, because I don't want to have my thumb taken out. So we've got a fist here, and all we're going to do then is walk over to the bed. So nice and slowly and gently, as we get close, I'm going to rotate the patient around, and the patient is going to keep moving back until they can feel the bed. And then from here, we can get the patient to start to reach down to the bed, and then staying in that position, we can then assist to sit down. That's good. From here, we have another method that we can use to help the patient get their bottom back on the bed. And what we can do here is rotate our bodies around, and standing in our fab stance, one hand on the hip, obviously gaining consent, ask the patient to start to reach for the bed, and we're going to say ready, steady, and sit. And I'm just pushing that hip forwards so that they can get into a nice, safe seated position on the edge of the bed.